Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good evening, dear viewers, ladies and gentlemen. Dr. Mohammed AlJubab, your host for Elixir of Life, live from Saudi TV, Channel 2, kicking off another inspiring and informative session with our distinguished guest. We aim to explore our new frontiers in medicine, keeping you up to date with the latest information related to health care. We'll go for a break. Please stay with us. Welcome back to Elixir of Life. Our next segment will be the quote of the week. Please stay with us. Don't go away. Once again, welcome back to Elixir of Life. Our next segment will be medical news. We'll start by the International Day of Persons with Disability. Please see more details on this report. Stay with us. Don't go away.
This is Dr. Faiz, Rehabilitation Medicine Chief Resident here in King Fahd Medical City. Actually, we are doing today, we are celebrating the International Day of People with Disability. This is actually an international event. This is occurring annually, and this is always, something to increase the awareness and to participate in helping the patient with disability to live their life normally as normal people.
This is a really great cause for helping others, especially people with disabilities. Please tell us your expectations from this event.
Okay. Actually, this event, it's, as I said, it's an annual event. This is something, the main focus of the event is to increase the awareness for the people with disability. So we are inviting actually multiple societies and also some of the governmental departments, which you can see now they are participating in this event. So we do some sort of communication between them, and in addition to that, to raise the awareness in the media for that very important thing.
I'm from Princess Noor University, from the College of Health and Rehabilitation Science. I'm the manager of our Academic Initiative and Community Project Unit in the college. We are here to represent our role as the faculty and the university for serving the disabled population in Saudi Arabia. Our college consists of 5 branches serving the disabled population, starting from the physical therapy, occupational therapy, speech and audiology, and clinical psychology. Okay, and also we have a unit which is targeting mainly the disabled population. We have a lot of initiatives and community projects serving this target population, who are the disabled population.
My name is Naif and I'm a physical therapist. I work at King Fahd Medical City Rehabilitation Hospital. So this is the International Day for People with Disability. This event is celebrated annually. And the purpose of this event is to raise awareness of people with disability into the community. And the theme of this year is Ana Gaddaha, which means believe in me. And we want to integrate people with disability more into our community and into the society so they become more productive people because they have a lot of potentials to do into the society.
I see a lot of health organizations are here today. Can you please tell us about them?
Yes, we have a lot of booths, as you can see, from different organizations and society in the community. For example, we have Harakiya Association, which is the Association of Adults with Disability. We have Princess Noura University. Of course, we have the Social Club from King Fahd Medical City, and we have Clinic One and the Paralympic Association, and we have Riyadh Social Club for people with disability, in addition to Matar Organization and Qiyam Institute, and we have the Ministry of Social Improvement and so many other booths.
Once again, welcome back to Elixir of Life. Our next segment will be a report about bariatric surgery workshop. Please see more details on this report. Stay with us, don't go away.
I'm Abdulsalam, a clinical dietitian from King Saud University. Here in our corner, we are providing advices to each part of the family to have healthy snacks, healthy diet, a healthy lifestyle. For example, we are telling them to instead of having chips for snacks, fast food, soft drinks, we are providing examples of snacks like nuts, popcorns, fruits, yogurt, milk, and that's it. Thank you.
Right now, kids are like watching TV, eating snacks, and eating like junk food. So, what do you like to say to them?
Okay, we'd like to advise the families, the fathers and mothers, to take control. To control their children, control the time they spend on watching TV, on playing with their mobile phones, their iPads. Let them play. Let them just be kids. Just play their original games they used to play before that.
This is Omar from the Clinical Dietitian Department. Today, I want just to give you an advice that it's basic advice for nutrition management in life. Choose the smart food. Like what? If you want to eat fruit or juicy fruit, what's the better to choose? Actually, the better is to eat the whole juice, because when you eat the whole fruit, that you're gonna have fibers and the minerals and whole vitamin. But when you doing the fruit as a juice, you just get rid from other benefit things from the same fruit. Also, choose the better or the healthy fats. What do we mean about the healthy fat? We mean the omega-3, omega-6 fats. That is healthy. You can take twice a week, like fish, any sea product, and that's it.
Hi, I'm a health educator. My name is Fatima, and today I will talk about the benefit of water. Most of the co-worker here do not drink water that too much, you know. Most of them go to their break, drink soda or juices. So I'm gonna talk to them about the water and how it's benefits. Some people doesn't drink water, you know, they don't like drink water too much. So our idea is to mix the water with the some flavors. So we have lemon and mint, which has a good benefit, you know. So the lemon has vitamin C, and it's helped to increase the immunization, give energy, breathness will be fresh, and they can lose weight when they mix the flavor or the fruit with the water. So this will help them to drink a lot of water as much as they can.
So right now you have lemon and mint.
Yes.
So it's really effective. Do you try?
Yes, it's so good actually. It's help, to make them, because the water will, absorb the flavor from the lemon and the mint. So they will drink more. It's not necessary to drink, use this flavor. They can use, any fruit like strawberry, orange, apple, any fruit they want.
Once again, welcome back to Elixir of Life. Our next segment will be health myth and fact. Children don't experience mental health problems, myth or fact? Please see more details in this report. Stay with us, don't go away. Welcome back to Elixir of Life. Welcome back to Elixir of Life. We are coming to the topic of the week, which is the episode theme. We talk about Saudi Society of Maxillofacial Surgery in collaboration with King Fahd Medical City held the 3rd International Conference for Saudi Society of Oral and Maxillofacial Surgery. There were recent advances in corrective jaw surgery. Now, it's our honor and pleasure to welcome our guest, Dr. Abdulsalam AlJubab. He is consultant maxillofacial surgery, chairman of dentistry, King Fahd Medical City, and the Secretary General of the Saudi Society of Oral and Maxillofacial Surgery. Welcome, Dr. Abdulsalam.
Welcome, Dr. Mohammed. Thank you so much for the hosting me, and I hope I can be a nice guest for you in your
It is our pleasure. Just without further ado, we'll go to the questions, starting by what was the purpose of your conference?
Excellent. The Saudi Society for Maxillofacial Surgery getting a habit of holding an annual international meeting. This is actually the 3rd meeting that held first time in Riyadh. There were 2 before were in Jeddah. The idea about this comes from the duties of the Saudi Society to bring the advances and the new technologies and the excellent speakers from all over the world to Saudi Arabia to host them there. So we give the chance for the surgeons in Saudi Arabia to get in direct contact with them and to listen to their lectures, which are the state of the art in maxillofacial surgery. So that's the aim of this conference, and we selected a theme of corrective jaw surgery because we noticed that this area in maxillofacial surgery is getting more popular those days. We see a lot of patients in the clinic every day looking for correcting their jaw relation, jaw surgery. A lot of advances happened in this era, so we selected to go in this theme to give more information for the Saudi surgeons about this area. This conference was held actually with the collaboration, as you said, with King Fahd Medical City, and we would like to thank the Postgraduate Training Affairs in King Fahd Medical City for helping us in organizing this major event, which is actually, it was a major success. We got a lot of replies and feedback. Everyone was happy about the conference, congratulating us for the success of the meeting. And that's what makes us happy and fulfill our duty.
Excellent, Dr. Abdulsalam. What were the teaching methods in this conference?
Excellent. We have actually three main teaching methods in this conference. It was the oral presentations, which was by the invited guest speakers from the United States. We invited two big world figures in corrective jaw surgery, Dr. Jeffrey Bosnick and Timothy Termont. And also oral presentation by surgeons from Saudi Arabia, from the Gulf countries like Oman, Bahrain, Egypt, and they actually presented very nice papers in the presentation. Very nice new techniques, and their experience were also given to us. And also from Saudi surgeons, we were too much impressed by the advanced in the skills and the knowledge of the Saudi surgeons in maxillofacial surgery. The second method was the oral poster presentations, which is composed of the research posters presented by residents, interns, and students as well.
Oh, really?
They were very active. We were amazed that some students, I think, showed interest in maxillofacial surgery from their undergrad. And the poster, what makes it more unique, that we made the international guests, Dr. Bosnick and Tim, to be the judge. And one Saudi intern, female, she won the first prize. So we gave her the certificates and the harmonium in the closing ceremony. It was a very good gesture. Excellent. The third method was the exhibition. We hosted the companies that produce the material, the instrument, devices, and new materials to in the maxillofacial surgery. We hosted them in the exhibition, which was the third and most interesting part of the conference, actually.
Very interesting, Dr. Abdulsalam. I think this is leading us to the next question. What's the anatomy of the face or maxillofacial area? And what's the scope of maxillofacial surgeon?
Thank you, Mohammed, for asking this question, because I think a lot of people, when they hear maxillofacial surgery, they start to think, what is this surgery is about?
Confuse it with dentistry.
It's confusing, yes. The maxillofacial surgery is a specialty of dentistry that deals with the treatment, diagnosis, and management of diseases and anomalies of the area of the face, facial bones, and the neck. It is actually a gray area. We share some areas with our colleagues in the ear, nose, and throat, and plastic surgeons. When you talk about the anatomy of maxillofacial, it includes the facial bone skeletons, which is composed of more than 23 bones around the eye, in the cranium, in the upper jaw, in the mid-face, in the joints, in the lower jaw, as well as many pathologies inside the oral cavity, as well as in the neck, like the salivary glands and the pathology of the oral cavity, which is actually, this is the territory of maxillofacial surgery. So mainly it is a specialty that is, I consider it unique because it held some areas of dentistry and some areas of medicine. And the trainee in that area, this specialty, need to spend half of his training in College of Medicine to be able to practice this specialty. So when you talk about maxillofacial region, you talk about the face, You mean the appearance or the globe of the eye, that is the bones around the orbit, the
you
nose.
can point out just okay.
Yes. So if you look at the facial skeleton in general, we can see the skull that is formed of 22 bones, including the frontal bone and the frontal sinuses, and also the bones around the eye that is protect the eye from trauma and give it the attachment for its muscle to move, as well as the nasal bones, which is our breathing passage, and the mid face, which is the zygoma prominences too, and then we have it is connected with a bone to the base of the skull, and there is also the upper jaw, which we call it the maxilla. So that's the reason we call it maxillofacial. It is maxilla, and in medical terminology, maxilla mean upper and lower jaw.
Excellent.
So they call it upper maxilla, lower maxilla sometimes. So it is a maxillofacial surgery related territories or these areas.
Thank you, Dr. Abdulsalam, for simplifying this complex, I will say, anatomy, and subspecialty. How common jaw problems?
They are very common. On daily basis, we see new patients that having a problem with their jaw. Either it is a developmental problem, congenital, or it is acquired problem like after trauma or after deformity, or there is a bad relation of the jaw, or there is pathology inside the jaw. So this is actually very common, and locally we don't have exactly statistics about the percentage of those prevalence, but what I can say that it may go with the international numbers of 25% of the patient they have jaw problems related to the jaw. Of all dental patients that you see on a daily basis. So there is a good number, and surprisingly every day we receive new cases and new referral, which means that the predominance of this disease or problem need to be studied and worth to be studied to have a national database for it at least.
I think this is interesting area for research for student or trainees.
Absolutely.
To look for the epidemiology of jaw problems.
Yes, most of the studies, there are some studies by interns and students about the prevalence of some diseases in the oral cavity or the maxillofacial region or anomalies. But to have all complete data, I think in Saudi Arabia with the prevalence, it's lacking, and it's worth actually effort to create a database for it.
You mentioned, various, congenital, traumatic, etc. So can you shed more light about the congenital problems of the jaw?
Excellent. So congenital problems of the jaw, which means the child or the newborn is born with a problem in his jaw. It is a broad spectrum of cases that can be affecting this, starting from the cleft lip and palate. The cleft lip and palate, which affect the upper jaw and the relation of the jaw, upper and lower, with each other. And it is actually a very devastating problem that faces the parent when they have a cleft child, because it means that they need to receive treatment from age 0 to age 18 years. Very comprehensive. Yes, which is include multiple surgeries, multiple team, and it is a multidisciplinary actually area. This is one of them. There are other congenital anomalies like the absence of the jaw. There is no jaw. Children born, especially the lower jaw, there is no jaw, which is a cause problem for the children or the newborn. They cannot breathe or swallow, and they stay in the ICU until getting old and need a close observation. And there is also a small jaw, like some syndromes, like Beer-Robin sequence or syndrome, which has very retruded jaw, and it cause also breathing and swallowing problem. It needs a surgical intervention at age of 3 months or less to advance the jaw, so to make the airway pattern they can breathe and get rid of the tracheostomy or the artificial tracheal airway. And also there is some diseases that are congenital affecting, like the Paget disease or Bassett disease, which is causing abnormal bone metabolism that causes changes in the bone. There are also other patients with children that are born with kidney insufficiencies. So it's affecting the jawbone, It's called renal osteodystrophy, which is mean they have prominent jaw bones because of the changes in the renal profile and renal enzymes. So this is a very broad pediatric maxillofacial area. It is dealing with those acquired or congenital problems of the jaw.
So maxillofacial surgeon is treating pediatric and adult.
Exactly. They are treating pediatrics and adults. So a big variety of age, extreme ages, 0 up to more than old ages, which are the patient with the cancers and all of those patients.
Excellent. Regarding cleft palate, what's the best age for surgical intervention?
Excellent. For the cleft palate, the child growth, usually the patient first, before going into the best timing, we need to know that cleft palate can happen alone or with a cleft lip combined. If it is with a cleft lip, it's better to close the lip at my age of 3 months. This is because the growth of the child is enough to tolerate the anesthesia and the blood loss. And then at age of 1 year to 1.5 years, we should close the palate, which is the hard and soft palate. The aim, because the child starts to speak. And then we need a good muscular anatomy at the oropharynx so they can pronounce and improve their speech. And we give a time for the growth of the maxilla by delaying the surgery for 1 more year. We leave a small opening between the anterior teeth, which is the cleft alveolus. We leave it until age of 9 to 11 years because at this time there are permanent dentition gonna grow, so we need to graft this area at later stage after starting the dental treatment. So it is a protocol that we follow for those cases.
Very enlightening, Dr. Abdulsalam, indeed. And next question will be, what kind of facial trauma that cause jaw problems?
Excellent. So we know first the car accident prevalence in Saudi Arabia is very high. And almost on daily basis we receive facial trauma patient, fresh cases that are hit, the smash the wheel drive or the front of the car or hit by a car or wherever. So that causes a fracture of the small bones of the face. When you have a fracture of one of the bones of the face and you do surgery early for it, the chance of deformity, for example, the lower jaw or the upper jaw, is very minimal. But there are some severe trauma, that causes loss of bone and soft tissue, and especially with car accident or some incidents of gunshots that the patient loses his bone and part of soft tissue. That causes disfigurement of the face, which call it secondary deformities, post-traumatic. Those cases actually needs more surgeries. Usually the results, they are not that much promising because of the scarring and the changes in the bone volume and the bone relation. So like we receive cases that patient received like a gunshot or a car accident, he lost part of his jaw. So this depends actually, to summarize, in the type of the injury that received. Is it a minor or major? The amount of tissue that has been affected. Is it a small amount or just simple fracture or comminuted or it's open with loss of bone? And depends also on the time of intervention. Some cases we receive them very late. So because of the lack of knowledge and the referral problems. So jaw trauma or jaw relation can be affected by trauma. Especially there is the fracture of the joint, the temporomandibular joint, which is the 2 joints in the side of the jaw. Very common in children, and it causes actually, it is a growth center for the children. So when the child receive a trauma, go unnoticed or undertreated, it will cause sometimes a fusion of the bone to the skull base, and the patient and the child cannot open. So this retards the growth of the lower jaw. So the children will grow with the retruded or going back lower jaw. So this is disfigurement of the jaw. And as well, loss of the teeth due to the trauma as well disturb the relation. It causes bone resorption. We lost bone after teeth trauma. So the deformity of the jaw exists or happen at that situation.
Yes. Is it only related to motor vehicle accident, or could be sports trauma?
Yes, sport trauma is getting more prevalence nowadays, actually.
Kind of sports,
like the sports that entitles contact, like the football or soccer or the basketballs or other sports or boxing. And it's very famous that we have the boxing bone fracture, which is the malar bone, which is under the eye, because when someone receives the hit to the face, mostly to the side of the nose, and there is a bone there called zygoma, which is give the prominence to the jaw and the aesthetic appearances, get the breast fracture and goes down. So this is most famous fracture in the fights or in the boxing or something like this entitled. Some also sucker injuries like getting in contact with other players can cause fractures of the nose, fracture of the malar bone, fracture of the lower jaw. So this is actually, you are right, Dr. Mohammed. Sport can be also one of the causes, but it's very little cases, alhamdulillah.
Okay, I think the next question is important. Can you elaborate more on the ignorance of dentation and effect on the jaw?
Excellent question. Ignorance and the dentation, some people think, what's the problem if I didn't clean my teeth? Then I may lose that tooth, so what? They don't know that if part of the jaw relation and the bone preservation are the stimulus from the existence of the teeth. When you lose teeth, when you see in old age people, the bones start to resorb. So the upper jaw goes back and the lower jaw goes in front. So that causes an aging appearance, and it actually requires a deformity of the jaw that is acquired, we can call it acquired, it is not congenital, and it needs a major surgeries to correct that, because the patient, after extracting many teeth, not replacing them immediately with implants or needed prosthesis, cause this change in the relation of the jaw and jaw deformity.
Okay, interesting indeed. What are the symptoms of the jaw that should not be ignored by the patient, like red flag, symptoms? Okay.
Excellent. The most important thing is the change in the sensation. If you start to feel numbness here and there in the jaw, in the tongue, in the lips, this is very warning sign. That means there is a problem inside the jawbone. Second thing is the pain. All right. Some of the problems that affects the jaw are the pain, either the pain from the joint itself or pain from inside the bone itself or related to the teeth. Third symptom, which be the swelling, sudden swelling. Patient wakes up or he notices a bump or increase in the swelling on the side of the face, upper and lower jaw. So those are the three warning signs: change in sensation, pain, and swelling or increase mass in the jaw.
I will elaborate more after going to the report. We'll go for a brief report about the third international conference of the Saudi Society of Oral and Maxillofacial Surgery. Please see more details in this report. Stay with us. Away.
First of all, I would like to thank the Saudi channel number 2 for covering our event. Actually, this is the third international conference for the Saudi Society of Oral Maxillofacial Surgery. It's held in collaboration with King Fahd Medical City, the dental department. And this is the third time it had been held now in Saudi Arabia, and the first time in Riyadh. We had been successful in getting most of the pronounced speakers from international countries like the United States and Canada and Europe. And we have the theme of corrective jaw surgery for this conference. There is also the exhibition accompanying the conference, which is going to be held over 3 days from 6 to 8 December. And there is also the research and poster presentations, and some workshops had been held and going to be held in the coming 3 days. So the objective is sharing the knowledge with international bodies in the world and international well-known people in the research and the field of maxillofacial surgery. And we hope to get the mutual benefit by getting that knowledge into Saudi Arabia to benefit our patients here.
Sir, are there speakers or international speakers can attend this event?
Yes, we had been lucky to get international speakers from the United States, from Germany, from India, from Egypt also, and there are speakers from the Gulf countries like Oman, Bahrain, Kuwait, and Saudi Arabia. So we are very happy to have all of those expert people in this conference.
So my name is Jeff Posnick. I'm a surgeon from Washington, D.C. I'm a plastic surgeon and an oral and maxillofacial surgeon, and I've been invited to the Saudi Society of Oral and Maxillofacial Surgery to be a speaker at their annual meeting, and it's a great pleasure to be here. And it's my first trip to Saudi Arabia, and it's a beautiful country, and the people are very nice and friendly. And I'm glad to be part of the scientific session here with the terrific surgical team and orthodontic team here in Saudi Arabia.
Sir, as a speaker, tell us about the latest development in your field. Can you share with us some information?
Well, what I do in my practice is I take care of children and young adults who have cleft lip and palate and who have jaw deformities. And jaw deformities affect people's speech, chewing, swallowing, breathing, and facial appearance. And some of the new techniques that we have available to us allow us to do a tremendous job in making improvements for children and young adults with cleft lip and palate and jaw deformities. And I've pioneered some of the work and done research on it, and I'm glad to share my experience and my thoughts with the Saudi surgeons who also have a lot of experience with these problems, and sharing ideas. Hopefully we'll even come up with better ways to fix these problems.
Sir, a message I'd like to send to the viewers. What's the message will be?
My message is that people with facial deformities are the same all around the world, and we can treat them we should treat them the same way all around the world, and it makes no difference what culture or country you come from. And it simply takes the focus, concentration, and experience of doctors to be able to help correct these problems.
Doctor, we thank you so much for your time and wish you all the best.
My pleasure. Thank you very much.
Once again, welcome back to Elixir of Life. Welcome back, Dr. Abdulsalam AlJubab, consultant maxillofacial surgery. And back to our topic, you have pointed out to the symptoms of jaw or problems of the jaw. Now, if a patient presented with a jaw problems, pain, you mentioned, or swelling or change of sensation, what are the diagnostic methods used?
Excellent question, Mohammed. First of all, we have to start with a complete examination of the patient. Actually, head and neck examination complete clinically is very important. We need to get a good history from the patient to check out when the symptoms started, how it started, related the events with the symptoms or no. Second thing, we go to many diagnostic aids for the maxillofacial region. We start with simple dental x-rays. We have the panoramic x-rays, which give like a two-dimensional imaging of the jaws, and advancing this to CT scan or computed tomography of the head and neck region. This can help us a lot with discovering the problem and defining the problem where it's exactly located and how to treat it. There are other modalities that needed in some diseases of the jaw, like the bone scanning, like the beta scanning, a lot of advanced imaging. Sometimes ultrasound is recommended also in some of the neck masses or something like that. So we have a big variety of diagnostic aids in maxillofacial region. Also, most importantly, there is the biopsy now. There is some new biopsy. That's not considered new, but like the brush biopsy, it's not like the routine biopsy. It is simply just touching the lesion with the brush, then spread it on the slide, and then the pathologist can help us in diagnosing the problem, exactly what the patient has. So basically, a good taking history of the patient is very important. Talking to the patient is a key in finding the problem and starting the what we call it the workup for the case. And now it is good that I can see in all over Saudi Arabia there is availability of those diagnostic aids. It's not something that is complicated or very limited to area. It is very predominant now in all the hospitals at our level of Saudi Arabia.
Thank you, Dr. Abdulsalam. Jaw problems or maxillofacial disorders are broad. So how they are treated in a broad sense?
Okay. Some treatment, they are medical treatment. It doesn't need any surgery. And some of them, they need surgery.
Okay.
And surprisingly, some of the tumors can be treated medically. Like one of the kind of the tumors that is called giant cell tumor of the jaw. There is some medical treatment, intralesional injections, some tablets can shrink or eliminate that tumor. But the mainstay treatment is surgery. Unfortunately, most of the conditions, they need surgery.
Excellent. Regarding the cancer that affect the maxillofacial area, what kind of cancers and what are the most common causes or risk factors in our society?
Excellent. The most common cancer that affect the maxillofacial region is the oral cancer, which is inside the mouth. Unfortunately, cancer happens, and it is one of the devastating cancer to treat. Because of many reasons, of the late diagnosis, the ignorance of the patients, and the patient sometimes comes late to us, which makes the treatment almost impossible. And the patient unfortunately may die from that. There are other cancers that the most common inside the mouth.
How did it start, this one? Because you mentioned most of them, they present late. How did it start?
Yes. There are many presentations we can see in the patient. Some patients, they said, I will feel a loose tooth. I went to the dentist. I took this tooth out. And then it never heals the site. So I kept washing my mouth with salty water, taking antibiotics, doesn't improve. And he didn't think or come to his mind this can be a problem or a symptom or a sign of cancer of the oral cavity, loosening of the teeth. Some people, they have no habit to screen their mouth. You know, there is breast screening, and there is a screening of for the oral cavity. It can be seen directly by the people every day in the morning. He can check his oral mucosa, his tongue, everything. So the people, they don't have that habit. So an ulcer start, it is usually painless. It's not noticed unless it gets more big and more very prominent. So the patient start to get worried and seek help for that problem. Other thing, there are some cancers inside the bone. So they never been seen by the patient and discovered incidentally on routine dental examination. When he goes to his dentist and they take an x-ray, they found a problem in his bone. There is bone changes, bone swelling, bone mass, something like this. So that's point to the importance of a regular dental checkup. At least every year, once for everyone, to go to his dentist and maybe discovering something early, and he can receive the treatment very early. The other thing in our society, there is habits like the smoking, like the chewing tobacco. This is actually one of the major causes of oral cancer, and we can see areas in Saudi Arabia, the oral cancer very predominant because of the chewing tobacco or GAT. That is one of the problem. And we notice in those patients that the cancer is very aggressive. That is, wherever you do for it, it recurs or never can be removed completely. So that's the problem that mostly that in our society we notice. The discovery late, sometimes the habits, lack of knowledge also. The people need to be educating themselves, and dentists need to educate the people actually how to screen their mouth. So it is a complex problem that causes this issue in oral cancer.
So chewing tobacco or smoking cigarette, both can cause oral cancer.
Absolutely.
But more with the chewing
exactly,
tobacco.
because of the chemical dissolved from chewing inside the mouth, it's penetrate the oral cavity layers. So that's what causes the changes in the mucosa and the changes leading to cancer as well.
Thank you, Dr. Abdulsalam. Now we'll go for the second report about the third international conference of the Saudi Society of Oral and Maxillofacial Surgery. Let's see more details in this report.
Here we have the maxillofacial prosthetic part in dental laboratory, King Fahd Medical City. We are doing here all type of prosthesia, maxillofacial prosthesia. Here you can see extraoral implant, nose prosthesia. This is good because sometimes when we are using the medical adhesive, we have a problem with some patient. They move already to the implant. The second one here, we are talking about maxillofacial prosthetic, silicone artificial ear with medical adhesive. Here it's out only we help another hospital with this type of prosthesia. This is finger prosthesia, and here this device is for artificial saliva device. This device, the patient with radiation, he can fill this by artificial saliva to use it within 12 hours per day. Here to help the radiotherapy department with some prosthesia radiation tank device to keep the tank under the device, under the radiation wave. Here we have the orbital prosthesia with implant, extraoral implant. And here we have orbital with adhesive material. And this one also we help another hospital with this device. It's out of our maxillofacial prosthetic lab.
Well, my name is Dr. Tim Tremont. I'm from Pittsburgh, Pennsylvania in the USA. I'm visiting here this week in Saudi Arabia to speak with Dr. Jeff Posnick about orthognathic surgery, and that's jaw surgery. And Dr. Posnick is a surgeon. I'm actually an orthodontist. And orthodontists work very closely with surgeons in treating patients that have jaw and facial deformities. And the orthodontist is responsible for moving the teeth in the mouth with braces to prepare the patient correctly for the surgeon to move the jaws. And I'm speaking on what we refer to as pre-surgical orthodontics. And enjoying my stay here, and many surgeons and orthodontists are here today for us to share our information with.
Once again, welcome back to Elixir of Life. Welcome, Dr. Abdulsalam AlJubab. We'll go for a very important question. We heard about temporomandibular joint dysfunction. What causes this,
Exactly.
syndrome?
First of all, this joint in the body, we have two joints on the side of the jaw, lower jaw, that is articulating or touching with the base of the skull. Yes,
yeah, this is the joint. This is
in front of there.
Yes.
So it's called temporo because of the temporal bone, mandibular because of the mandibular bone. So it is a joint between the base of the skull, temporal bone, and mandibular bone.
So jaw joint, we call it.
Yeah, it is a joint. It's a synovial joint. It's a special type of joint. And surprisingly, it is the most in the top of the joints which receive the loads compared to other joints of the body. We talk, we eat, we move our jaws, so it is very functioning joint throughout the day. This joint has a complex anatomy. It has many ligaments, it has a disc inside, it has bone involved, it has muscles involved. So this temporomandibular joint dysfunction is a name given for the disease that involve the joint and the related muscles and bone. So some patient will start to hear a click next to his ear, sudden, so he get worried, and he try to repeat it again and again. Some people start to feel pain in the ear, some people start to feel pain in the muscles in the back of the neck or in the side of the jaw. So they start to get worried. This is all what they call the symptoms of the temporomandibular joint dysfunction. And it actually has two main categories. It is a problem that is mainly related to systemic diseases like the osteoarthritis of the body. This is a joint in the body, so it will be affected. Or it could be related to trauma. Some people receive a hit or eat something hard. It can be related to as simple as 1 millimeter high filling than the rest of the teeth. If you do a tooth filling, It is not that well done, so a very high as low as 1 millimeter can cause disturbance in the joint function. So other thing, the malaligned teeth. The teeth, they are not closing well, they are not well aligned, also causes more load in the joint. So this causes joint dysfunction, as well as loss of the teeth. Some people, they don't have molar teeth or posterior teeth, so the joint is not helped by the teeth to rest. So most of the time it is under function, the muscles, and it is guarding, so that causes the pain in that area. So that's collectively called the temporomandibular joint dysfunction, and it is also the position of the patient. Sometimes people spend a long time in front of the computer screens in a called the swimming head position, which is the head up. Which causes this problem is muscle fatigues, and it is reflected in the joint. So it has pain, click. Sometimes the patient cannot open his mouth. So that is the complex. It's for that reason it's called a dysfunction with many diseases entity inside it.
And the prognosis is good or bad?
Depends. Sometimes there are tumors inside the joint bone. Sometimes it is related to systemic issue like osteoarthritis. It needs a medication, systemic medication. Sometimes if it is a simple dysfunction due to simple cause like muscle or something, the prognosis is good if the patient comes to the surgeon early and receive the treatment early.
So it is variable depending
it is
on the
variable,
cause.
yeah.
Thank you, Dr. Abdulsalam AlJubab, consultant maxillofacial surgery,
Thank you.
chairman of dentistry, King Fahd Medical City. Thank you. It was a great honor and pleasure being with us.
Thank you so much, Mohammed, and the honor all mine. And thank you for Channel 2 for hosting me.
Okay.
Thanks a lot.
Thank you. Now we are going for the last segment. We'll talk about health benefit of onion. Please see more details in this report. Once again, welcome back to Elixir of Life. We wish you enjoyed watching our episode and found it useful. Before I conclude, I would like to thank our distinguished team headed by Director Abdullah Al-Wulai'i, Lighting Fahad Al-Yahyan, Fawaz Al-Rusayis, Cameraman Nasr Al-Mutayri, Yazid Al-Husseini, Sound Mohammed Al-Qasim, presented by Rehab Al-Khulaitit and presented by me, Dr. Mohammed Al-Sheef. Until next episode, we wish you a pleasant week ahead. Assalamu alaikum. Goodbye.